So that's the other thing that we look for is symmetry in the face. So I want the eyes in the right position. Now, a lot of times, as I said, this can be happening when a baby's got a torticollis. Now, when I treat a torticollis, I'm looking at different things. If you go to a traditional physical therapist, they will have the mother stretch the neck and go through full range of motion, side bending, rotation, rotation. So have you ever woken up with a stiff neck? Have you ever had anybody try to stretch your neck? There's a reason why the baby cries, because it's incredibly painful, and I think that this is a very archaic way of treating a torticollis. We need to get to the root of the problem. So going back to the way I said, the first thing I need to look at is the pelvis. So if this is crooked and the bum cheeks are off, they're sometimes twisting a lot of things. The dura might be twisted. So now the baby's head is crooked. So this might not be necessarily coming from the neck. It could be coming from lower down, which is why we have to look at the whole thing, not just the head and the face. So if they're twisted like this, when I correct this, sometimes this already will start to relax. Now, if it doesn't, now I'm going to look at other things. So going back to the occipital bone, this is hugely important. That purple bone is in 4 pieces, okay? So if it's flat on one side or flat in the back, it's going to change a lot about that big hole we talked about, the foramen magnum, where the spinal cord comes through. The reason for that is those 4 pieces make up the 4 edges of the foramen magnum. So one is the bowl. These little bumps are called pedicles. The pedicle is where it's like a rocking chair shaped. It sits on the first cervical vertebra, okay? The second part, fourth part is right here. So when you have this in 4 pieces, if this is off to one side, it changes the diameter of that hole. And we want that hole to be its optimal size because the spinal cord has to go through it, and we don't want anything around the spinal cord. It's like an electrical cord that goes to everything in the body. We want it to have all the room it can possibly have so that everything else in the body functions properly. Okay? So if a baby's twisted like that and it's got a flat head, that means this is off to one side and the pedicles have shifted. So this will finish fusing around age 8. If the baby has a flat head, or a misshapen head, or a torticollis that never got corrected, or a pelvis that's never been corrected, when that fuses, the baby will always be crooked, and you will never be able to get it to line up because it fused crooked. I don't care how many adjustments you have to your upper cervical, you're not going to be able to change that. It fused, okay? So this is hugely important. So I want to also look at these 2 little holes. I don't know if you can see them, but there's 2 little holes between the red bone and the purple bone, okay? So when we look at the cranial base, I kind of look at it like a sieve. So we've got this big bone with all these holes. All those holes are there for a reason. So there's either a cranial nerve going through there, there's an artery going through there, or there's a vein going from the heart back up, okay? So what's really interesting about those 2 big holes, which we call the jugular foramen, is first of all the jugular vein drains out of it, okay? And there's 3 cranial nerves. One is the vagus, so again, colic and reflux. That's why we have to release pressure from the occiput. When we do that, we give more space to those little holes. The other is glossopharyngeal, so it's the way the baby uses its tongue, and hypoglossal, so how the baby swallows. So sometimes the baby's not sucking, it's not latching on very well, it's got a twisted neck, and it's got colic. So actually all those 4 things can be connected to one problem, which is a compression of the jugular vein. The other thing that will happen, because it's a vein, if the vein's got a little compromise and it's not draining properly, this baby can have a head that's not in proportion to its body size. Its head will be bigger than the body. and it's not balanced because the vein is not draining the blood fast enough. So as it backs up, it causes more pressure, and the head will be a little bit bigger than the body size. So when you see somebody who's correcting a wry neck, or whatever reason, maybe, I used to get a lot of people who would come to me because they wanted to get fitted for a helmet for the baby, because the baby's head is flat. So when you're getting a helmet, the helmet is not looking at the whole picture here. It's kind of like wearing braces. It's just shaping and shaping and shaping, and the helmet can take anywhere from 9 months to a year. That's a very long time. I can shape a baby's head depending on their age, how much I can get done. Like if they're crying, I need to be able to calm them down very quickly, sneak in and get the work done quickly. And also, if there's any other issues with the baby, hopefully, a lot of normal healthy babies are born with this. They're normally healthy. If a baby's in NICU or something, it's going to be some other issues. But normally I can probably shape a baby's head and face in about 6 to 8 sessions. So that's much faster than a helmet that can take up to 9 months or maybe even a year. But the more important thing is I'm looking at the reason why it's happening. I'm not just trying to support the dysfunction by changing it. And as far as I know, the helmets don't look at the facial alignment. It's just looking at the shape of the head. So yeah, as soon as you can get these things done, the better. So I'm going to go back to the 7 soft spots. So this 4 bones have to overlap so the baby can go through the birth canal. So now sometimes this is very normal and natural, and also can be corrected. A natural delivery can also cause a facial asymmetry. The reason for that, and the many factors, usually if it's a firstborn baby, the size of the baby's head, the size of the mother's pelvis. Babies tend to lead with the left side, so when they go through the birth canal, the left side of the baby's face will drag along the mother's sacrum, okay? That can leave an imprint, okay? So sometimes what will happen is the left eye is smaller and it's a little bit higher. This can be fixed very quickly. And it's always interesting because a lot of people say, oh, that's hereditary because my grandfather had it or my father had it. Well, chances are that person was a natural delivery. And also it's more common with the firstborn or the secondborn. Any babies after that, because the pelvis has already had a few babies coming through the birth canal, it's going to have changed its shape a little bit, so the babies that are born later may not have that pattern. Now, but I have to say, it's really interesting. Once I had a mother, all the babies had the same thing, but the mother had a problem with her sacrum. And so I think she broke her tailbone, and it was twisted. So when she had all her babies, the babies all dragged across the sacrum, and it left an imprint, and it dragged the facial bone so that there was a little bit of asymmetry there. So going back to why do we want the eyes to be symmetrical? We want the eyes to be symmetrical because we have a reflex that we track objects in the horizontal plane, okay? And it's such a strong reflex. If one eye is here, one eye is here, we'll do this to make our eyes more level, okay? So now we end up with a little bit of a twist in our neck. As a matter of fact, the facial bones over time will shift dramatically to try to get the eyes in the horizontal plane. So a lot of people will think of this as a cosmetic reason. I'm going to tell you why this is not a cosmetic problem. It is, but that's not why I'm doing it. Although it's nice to be symmetrical. I'm not symmetrical. I've had a lot of work done to, like when I say 6 hours on a baby, the amount of work I have had, probably 50 hours worth of work, and also me working on myself to try to get my bones to move. Since they fuse, it's a little bit more work. But I've been able to make, this left eye used to be a lot smaller than my right eye. But it's interesting. I would think being a twin, my sister would have paved the way for me, but obviously not enough because I ended up with what's called a left facial slant. Okay. So going back to the cranial base. So all those holes, you get, now I hope you understand why we want to make sure the back of the head is shaped, because we want the foramen magnum to be as big as it can be. Well, all the other holes matter too, because those are cranial nerves and veins, okay? So the cranial nerves and veins, when you see two bones coming together, a cranial nerve or a vein goes through there, okay? And so we want to make sure that the bones are symmetrical so we don't have any problems with blood flow, and for the electrical system, which is a cranial nerve, whether it's going to the eye or for the tongue or for smell, all these things are important. So when this is symmetrical, that foramen or that hole is as big as it can possibly be, so it's not being pinched when it goes through the birth canal. Or I'm sorry, when it's going through the foramen that's designed for that particular structure. Now, arteries are really interesting. When you see a hole that's going through one bone, that's an artery. And I think it's absolutely fascinating that we were designed in such a way that if we hit our head really hard, that we don't disrupt two bones and sever an artery, because that for sure would kill you. But we were created in such a way, we're very special, so that our arteries are protected because they only go through one bone.